Hello, I'm Emma Howard and we're talking about breastfeeding here on the Baby Channel. With me is Heather Welford from the NCT, or a breastfeeding counsellor. And sitting next to us today we've got Deborah with 7.5-month-old Anna. You've had a really good experience with breastfeeding, haven't you? You had an easy time, easier than most people I've come across. And yet you sought the help of a breastfeeding advice group. Why was that?
Because when she was just under 6 months, she got her first tooth. Well, she got 2 teeth within a week, and it was okay for the first perhaps 2 or 3 weeks.
Yeah.
And then we had a phase of biting.
And that's very painful, isn't it?
Yeah, during most feeds, her tongue actually sits on top of her teeth, so it doesn't hurt at all because she covers it herself. But she just was, I think she was experimenting, and she was biting and dragging, and it was really, really painful. So I went and asked for some advice about what to do, how to manage it.
And did you find that talking to other mothers who've been through the same thing was just invaluable?
Yeah. I mean, to have somebody, you know, who's actually breastfed, and to say, oh yeah, that must be, because everybody...
To grimace the way you
yes. That was very useful. And touch wood, it should be something that's gone away now. I've had it occasionally since, but I'm told just to say no and to try and pull her away.
It's an interesting concept, isn't it, Heather, that we're all told to pull our babies off the breast and look at them very firmly and say no, because some mothers say, but they're too young to understand this concept.
I think it's not so much pulling off, it's just gently removing. I'm sure you were told to do this, Deborah. Just gently remove and
but
say no.
But that's hard too, isn't it? The gently removing when you've been bitten. That, because your reaction is to do it much more quickly than that.
I had to sort of put my finger into her mouth to break the seal and then gradually pull her away. Or the other thing I've tried is to actually pull her nearer so that she opens her mouth wider and she lets go herself.
That's a good idea.
Yeah, but I haven't had to do it too much, so I don't really know which is more effective.
So the idea, though, is to not go with your instinct, which is to go, ow, and yank them off. That really must be avoided. Yeah. Easier said than done, though, isn't it?
I know, but it was great that Deborah found some mothers who tried that and it worked for them. And it's good, I think, that we've got a lot of breastfeeding support groups up and down the country, and if mothers need to know where their nearest one is, their health visitor or their baby clinic should know what is there, perhaps round the corner from them. And if you're from a family where your mum or your sisters and your friends perhaps haven't breastfed and you're doing it on your own, this is a good way of finding other people who've gone through perhaps the same thing as you, and it gives you a good chance to have a break. And babies like socialising often as well.
Yes, and we can see Anna certainly does.
Yeah.
But at any stage, I mean, lots of people think if they go at the beginning, they have problems. You often have problems at the beginning of breastfeeding. It's the most likely time for all those difficulties.
That's true.
But here's an example of somebody who went when they were further down the road.
It's a good place where people can go, and they know that even if they're breastfeeding an older baby, perhaps that's a new thing for them, there will be other people there who are doing the same thing. And it's like Deborah says, it's an informal, supportive, friendly atmosphere.
And if we look at Anna, this is a totally breastfed baby. I mean, she's big and bonny and thriving.
She is.
She had her first cold, last week. So
she had her first cold last week, and she's 7.5 months. So she's done very well. That is one of the benefits of breastfeeding, isn't it? The health benefits. Just remind us of what they are.
That's right. The antibodies in the mother's milk give the baby's immune system a boost. And we know this from research, not just in individual cases like Deborah, but we know from research that has looked at many thousands of babies that babies who are breastfed are less likely to get the sort of infections that we expect as part of babyhood, but they'll get them less frequently and less severely. So chest, ear infections, hospitalizations are all much more common in babies who are formula fed. So mothers are doing their babies a real good favour, and it's a lasting favour. Even after breastfeeding has ceased, the research shows that babies and toddlers and young children are healthier as a result of being breastfed.
And we are all getting this message and have been given it for quite a long time. So therefore the pressure on new mothers to breastfeed is all the greater. And they feel they've really failed very early on if it's not going right. I mean, those are the mothers that need to hear from people like you more than mums like Deborah. It's lovely to see this wonderful coupling here. They've obviously got on with it very well. But For women at the very early stages, you know, when you think it's all going wrong, what do you say to women like that? I mean, you presumably say persevere.
Yeah, well, we probably wouldn't say persevere, because you need to give practical guidance to people rather than just encouragement.
Yes, how do you persevere?
Yeah, you know, what do I need to do that needs to change, or is my baby normal? Is what's happening normal? Is that part and parcel of breastfeeding? I think too that the campaign and the suggestions and the reminders that breastfeeding brings measurable health benefits to babies has to be only part of the story. Women have to be supported and given good information, because that's a rotten trick to play on people, to tell them that breastfeeding is a wonderful thing to do and your baby will be healthier, and then leave people in misery and pain.
And yet so many women do tell this story, particularly to people like you, don't they?
There's a real gap in good informed support out there. We need encouragement and friendship, the sort of thing that you get at a breastfeeding support group, and women also need some practical guidance, how to position their babies if their baby is causing them pain. Not just persevere, because that's not going to make those sore nipples
especially in the wrong position. Persevering would make it an awful lot worse.
Yeah.
And to remind everybody that it's not just the learning experience for the mother, it's a learning experience for the baby, even though there's instinct and it's a very natural thing to be doing. They both have to learn how to feed.
That's right, and it's something that doesn't always happen instantaneously.
No, for thousands of women, that's absolutely right. You wouldn't have these support groups if it was so easy.
That's right. We've lost a little bit of the knowledge of how breastfeeding works, because in previous couple of generations, it's been much more normal to bottle feed.
And here's Anna feeding from a bottle of water.
Yeah, she's enjoying it.
She won't take her milk from that. Do carry on, Heather.
Yeah, it's we have lost the art, if you like, of breastfeeding. In societies where everybody has breastfed, women don't have as many problems with breastfeeding. So we need to plug that gap a little bit, as well as telling women they're doing a great job and they're making a real difference to their baby's health. We need to explain to them what is normal, that a baby in the very early days and weeks may well feed very frequently. It's because breast milk is very easily digested and babies' tummies are very small. So round-the-clock feeding is part and parcel of normal breastfeeding.
So at different ages, and here we are much further down the road with Anna, who's 7.5 months, who is so interested in the world that she doesn't feed in a very focused way. Yeah. Shall we see if she'll feed for us? She might give us a great demonstration of what it's like to be 7.5 months. And I don't want to feed now. Yeah. She might not want to feed with a bottle of water in her hand. What do you think, Deborah?
We can try.
Let's see if she will. She has done for us in the past, but why she should conform to our schedule, I don't know. Oh, look, where are you taking that water, she's saying? Yeah. So she won't take milk in a bottle, but she will take water.
Yeah. I haven't tried for a couple of weeks, so
we'll see. And talk us through what Deborah's doing, Heather.
Right. Well, she's obviously putting Anna in a position where Anna probably knows
what's coming.
What's coming next, and I wonder when Anna will twig that she probably. Yeah, she's already turning round. A new baby, you would have tummy to mummy. Yeah. An older baby like Anna can get hold of the breast.
Because this is a very experienced duo we've got here.
Yes, it's not like a baby aged a week or even a month.
No.
Here we go, nice and close in, and Deborah's supporting Anna, and Anna says, no, thank you.
Yeah, and Anna says, there's more interesting things around me.
I'll have a little lick, but that's it.
But she is very, now she's gone back on. She knows it's there, she knows what to do.
Yeah,
so do you, Deborah.
Yeah.
And Deborah, do you think you'll carry on for a long time? Have you decided when you'll cut off?
I haven't got a specific time in mind.
But you want to go back to work, I know, and do some part-time work and carry on feeding her. So that's quite a transition to be managed, but you've thought about how you'll do that. Oh, she's... You were far more fascinating, Heather, clearly, than the breast.
Yeah.
Well, to be fair, she wasn't really hungry, but she's going to have a bit. Yeah. Have a bit.
This is really typical of an older baby who knows what she wants. It's very good at communicating, and we'll have a little play around sometimes.
The only downside to this, of course, is you're very confident, your baby's very confident, but you wouldn't be out in a cafe doing it because you've lost all that discretion that's so nice. When you're out feeding, which is a lovely thing to do, you just want them to go on quickly so that you can sit and continue your chat and your cappuccino. But at this age...
Well, that's what she's wanting to do.
Yes, exactly.
She's continuing her chat and cappuccino. You are.
Absolutely. What a fantastic demonstration of what it's like to be an aware baby in the world.
Yeah.
We've run out of time, Lace, so we'll leave it there for now. Thank you very much, Deborah and Anna. Yeah, I can thank you for the hello.
And thank you, Heather.
Thank you.